Hi, I'm Vicki Smith. Today we're going to talk about the advanced practice nurse educator and the integration of clinical simulation technology in the classroom. At the end of this presentation, the learner will be able to classify the benefits of utilizing clinical simulation in nursing education, identify expected student nurse outcomes, and identify key points for program success. So utilization methodology, what brought all this about? Limited facility participation and competition for clinical sites among nursing students has led to the integration of clinical simulation experiences so that students can get real life experiences in the clinical setting. It is in a controlled environment. The simulated experiences are predetermined, and they parallel the educational level of the student. It allows for the integration of psychomotor skills, clinical judgment, critical thinking, and communication skills among the participants. And the outcomes are non-punitive for the patient and for the student. So the student rationale for the implementation, there's limited facility participation for clinical experiences. The sites have either reduced the participation days for the students or they have totally eliminated them altogether due to liability issues. There's focus skills and intervention. As y'all know, a clinical day may not give you all of the skills that you need to be successful in your careers, but in the sim lab, these experiences can be monitored and developed so that you can get optimal learning experiences. Non-punitive for the learner, and again, there's zero harm to the patient. The nurse educator's implications for learning. The educator must understand the technology used and have access to technological support while the program is implemented. Many times this means that the nurse educator has to go back to school to get the specialized training. But it's not just for the technological support and understanding of the program. It's also so that educator can learn how to incorporate evidence-based practice into the simulation experiences. Generational learning styles. The new millennial generation of learners really require a technologically savvy curriculum that allows for active participation, group dynamics, and immersion into the learning experience. Another hallmark of this generation is immediate feedback and critique. The sim scenarios can allow this. You get immediate feedback at that time. One of the examples for successful integration of the simulation experiences was brought about by the American Heart Association in their resuscitation quality improvement program, the RQI. Have y'all heard of the RQI? In this program, a quarterly competency is given to the learner. It combines online case scenarios and hands-on skills algorithms, or computer-assisted algorithms with hands-on skills competencies. They did the measured outcome is a continuous certification program for ACLS and BLS. Studies have shown that as early as 6 months after initial certification, there's a decay in skills for the ACLS algorithms and the BLS. So this allows quarterly a revisit, so the staff does not lose that. It's kind of like if you don't use it, you lose it. So it is. Yes. So the effectiveness of the clinical simulations, studies have shown that there are higher scores on the pre-graduation exit exams. successful completion of the cognitive skill competencies, and a positive integration of didactic knowledge and the skills application. There again, theory versus practice. So evaluation of the program and objectives. Research participants reported that the use of simulation helped in other areas of their education, not just the ability to choose the correct intervention. Some of these were that critical skills were sharpened through hands-on experiential learning, the psychomotor skills, videotaping scenarios, and the debriefing section. It increased the development of effective communication skills, and there were opportunities for teamwork and delegation during the scenarios. So key points for the program's success. The clinical simulations must be viewed as realistic by both the nurse educator and the student. It's not playtime. Ground rules for professional behavior have to be established beforehand. And policies and procedures regarding the recording of these scenarios and the confidentiality need to be established. Successful debriefing periods. This is essential to collect data regarding the student experience, the scenario relevancy, and the outcomes. And of course, it's also for the evaluation of the student learning process. Y'all had your y'all's sim lab. Oh, not yet. Okay, I thought you already had that. Oh, next week. You'll have a great sim lab. Okay, so what lies ahead for the clinical simulators or simulation? The increased use of the sim labs will ensure that each student is afforded the opportunity to be successful in a myriad of scenarios. The student will be able to react and interact during crisis situations without fear of harm to the patient. Guidance from the nurse educator will also allow for developing well-rounded staff who can respond in different situations. And continuing research to allow for the integration of evidence-based practice will solidify the classroom taught theory into actual practice for you, our future nursing personnel. Do y'all have any questions? Comments? Good job. Okay. Well, thank y'all very much.
Thank you. Thank you.